Hello everyone, I'm Dr. Bang, the hair wizard who protects your hair. It's a pleasure to meet you all. Today we'll once again take a look at eyebrow hair transplantation. As you can tell just by looking, today's case is a man in his mid-20s. He underwent an eyebrow tattoo procedure. As you can see, the outer part of his eyebrow is missing. It wasn't always like this. If you look closely, it's a scar. This is a case where he got an eyebrow tattoo, was unhappy with the tattoo, underwent laser hair removal, and then developed a scar from the laser hair removal. This led to the shedding of the original hair, including the eyebrow hair in that area, resulting in the complete disappearance of the end of his eyebrow. This person had a complex about their eyebrows, so they hastily got an eyebrow tattoo. They disliked the tattoo, so they had laser hair removal, and now the situation has progressed to where they cannot expose their eyebrow area at all. The patient has some density in the front, but the back is completely gone, which actually makes it a very difficult case surgically. So, as I always do with patients, I asked him about his realistic expectations. Because it's a scar, the graft survival rate might be lower after the transplant, and one surgery might not be enough to fix it. When I asked about his expectations, his reply was truly sad. He simply wanted to go back to before the tattoo. Hearing that, I knew we should do the transplant right away. It's because the patient isn't expecting something fantastical, right? As I usually explain, a transplant typically requires over 200 grafts per side. But for this patient, since his existing eyebrows at the front are quite dark, we can't let the density drop too much. I mentioned that there are two ways to approach transplanting onto a scar. I explained there are two methods. One is to initially implant a density exceeding the required hair graft count, ensuring survival even if the graft survival rate is somewhat reduced. The other is to first transplant 50 to 70% of the adequate amount, followed by a second surgery later. However, the difficult thing about eyebrow surgery is that it becomes very noticeable after the operation. Most importantly, the eyelids and the area around the eyes get swollen. When there's swelling and bruising, women can cover it with makeup, but for men, it's really hard to hide. So that means the surgery often has to be scheduled during a recovery period. That's why in many cases, eyebrow procedures need to be completed in a single session. So this person, being ambitious, had about 250 grafts per side, transplanting a total of 500 grafts. What I noticed during the transplant was that the inner areas were very hard. In cases like this, I'm actually honest with the patient during the surgery. I'll say, certain areas are hard, which might lead to curly hair growth or lower density after implantation. We'll keep a close eye on this part later, but this is unavoidable because it's a pre-existing scar. I explained this before proceeding with the transplant. Fortunately, the patient's blood circulation was good, so the graft survival rate was high. So if you look at the photo after about a year, you can see that the density is a little bit lower at the back compared to the front. However, overall, the eyebrows look much more natural than they did prior to the operation. The shape is also fuller and more defined, just like the patient wanted. The main reason I created this content is to caution you against viewing eyebrow tattoos as a simple, easy decision. You might think, oh, a tattoo will fill them in. That's good. But when you get a tattoo, I must ask you to make sure they don't damage your existing eyebrows too much. You should definitely make this request, not just ask them to make it darker. If you do that, your existing eyebrows might get damaged and disappear. This can lead to problems with laser hair removal, and as issues accumulate, you could end up like this patient, regretting the procedure and wishing you hadn't undergone the eyebrow hair transplantation. Still, luckily the transplant made her look better than before, and she is satisfied. But eyebrow hair transplantation is never easy. The process also requires a long wait, so I want to emphasize that you should be more cautious with tattoos. And if you do get one, you need to be more mindful. And if you've had an eyebrow tattoo and are not happy with the results, eyebrow hair transplantation can be an excellent alternative, so it would be beneficial to schedule a consultation. Today we briefly covered the eyebrow tattoo and eyebrow hair transplantation. I hope this was helpful. Thank you.